Snake bite. Few facts. There are two important groups or families. Elapidae have short, permanently erect fangs. This family includes the cobra, karates, coral snakes, and sea snakes. Viperidae have long fangs which are normally folded up against the upper jaw, but the snake strikes are erected as viper. Elapidae. Karates. Karates are found all over India, has pale white bands and large hexagonal scales in the top of the snake. Banded karat. Black and yellow bands found in West Bengal, Madhya Pradesh, Andhra Pradesh, Bihar and Odisha. Short, permanently erect fang of a typical elapidae. Viperidae have long fangs which are normally folded up against the upper jaw, but when the snake strikes are erected. Russell vipers. Detail of fangs. Pit viper encountered under bushes and leaf litter or in bushes. Hematotoxic venom causes renal failure. Late onset envenoming. No effective antivenom. Key identification features. Large plate scales on the head. General symptoms and signs. Nausea, vomiting, malaise, abdominal pain, weakness, drowsiness, prostration. Cardiovascular. Visual disturbances, dizziness, faintness, collapse, shock, hypotension, cardiac arrhythmias. Pulmonary edema, conjunctiva edema. Generalized signs by fang mark. Poisonous snakes have elliptical pupil while the non-poisonous snake have round pupil. But in many cases the treatment is given on suspected snake bite on the basis of general symptoms despite no fang mark on the body. Karat bites are nocturnal, indoor, unprovoked and painless. Cobra and viper bites are very painful and accompanied by paralysis, coagulopathy. Local symptoms and signs. Fang mark, local pain, local bleeding, bruising, lymphangitis, lymph node enlargement, inflammation, swelling, redness, heat, blistering, local infection, abscess formation, necrosis. Physical examination. Vital signs: airway, breathing and circulation, fang mark or scratches, local tissue destruction, soft pitting edema that generally develops after 6 to 12 hours but may start within 5 minutes. Bullae, streaking, erythema or discoloration, contusion. Systemic toxicity: hypotension, petachia, epistaxis, hemoptysis, paresthesias and diathesis. 4 were neuromuscular blockade and respiratory distress. Symptoms and signs when venom has been injected: following the immediate pain of mechanical penetration of the skin by snake's fangs, there may be increasing local pain, burning, bursting, throbbing at the site of bite. Local: swelling that gradually extends proximally up the bitten limb. Tender, painful enlargement of the regional lymph nodes draining the site of bite. Bite by karaits, sea snakes and Philippine cobras may be virtually painless and may cause negligible local swelling. Symptoms and signs vary according to the species of snake responsible for the bite and the amount of venom injected. Some may develop vasovagal shock after the bite or suspected bite, faintness and collapse with profound slowing of the heart. The bite of most poisonous snakes leave mark of 2 fangs and sometimes little marks made by the other teeth. Symptoms and signs when venom has not been injected. Some people who are bitten by snakes or suspect or imagine that they have been bitten may develop quite striking symptoms and signs even when no venom has been injected. The bite of a snake that is not poisonous leaves only 2 rows of teeth mark but no fang marks. This results from an understandable fear of the consequences of a real venomous bite. Others may become highly agitated and irritational and may develop a wide range of misleading symptoms. General symptoms of snake bite: vision, blurring, heart and vessels, rapid pulse, low blood pressure, severe shock, muscular, convulsions, loss of consciousness, loss of coordination, weakness, gastric, nausea and vomiting, intestinal, diarrhea. Other skin sites: bleeding spots, tingling, sweating, wound site, bleeding, fang marks, discoloration, burning sensation, swelling, respiratory, breathing difficulty, systemic, fever, severe pain, central, dizziness, fainting, increased thirst, headache. Aims of first aid: attempt to retard systemic absorption of venom, preserve life and prevent complications before the patient can receive medical care, control distressing or dangerous early symptoms of envenoming, arrange the transport of patient to a place where they can receive medical care. Above all, do no harm. Recommended first aid methods: reassure the victim who may be very anxious. Bitten limb with a splint or sling. Consider pressure immobilization for some elipid bites. Avoid any interference with the bite wound, as this may introduce infection, increase absorption of the venom, and increase local bleeding. Pressure immobilization method: an elasticated stretchy crepe bandage approximately 10 cm wide and at least 4.5 meter long should be used. If that is not available, any long strip of material can be used. The bandage is bound firmly around the entire bitten limb, starting distally around the fingers or toes and moving proximally to include a rigid splint. A bandage is bound as tightly as far as a sprained ankle, but not so tightly that the peripheral pulse, radial, posterior tibial, dorsalis pedis is occluded, or that a finger cannot easily be slipped between the layers. Management of snake bite: transport to hospital, rapid clinical assessment and resuscitation, detailed clinical assessment and species diagnosis, investigations, laboratory tests, antivenom treatment, observation of the response to antivenom, decision about the need for further doses of antivenom, supportive ancillary treatment, treatment of bitten part, rehabilitation, treatment of chronic complications.